Okay, so today I wanted to talk a little bit about what it would happen if you do a consult or assessment here at Magnolia Health. So I'm Aaron Meese. I'm a board certified natural health practitioner. And when you come here, we're going to do one of three things, or we're going to target one of three things that I specialize in. I specialize in a natural health assessment, biohacking your current health, and then women and men, male hormones, primarily women's hormones is really one of my specialties. So what we're doing here is you're going to come in and you're going to basically fill out an intake form and kind of, which gives an assessment of all, or a detail of each and every one of the health issues that, or health challenges, or just in general, how you live your life. That can be a real insightful way to kind of give us a baseline. What are the expectations that you have? What are you looking for? Do you need some body support for some sort of ailment, or do you want to just improve your health, which would be the biohacking component, which I have a real passion for as well. So you would come in, we would do a health assessment, we would go through an interview basically process of what's going on and what you're looking to improve, and then through various modalities such as MMRT, muscle response testing, iridology, looking at your hair, skin, and nails, and other modalities, we would come up with basically a report that would say, here's ways to support what you're genetically predisposed to, because a lot of how each and every one of us are affected by the foods we eat, the chemicals around us, even the supplements and things that we take are things that we are predisposed by our genetics. And it's the reason that the medical industry really doesn't want anything to do with not being able to just give you and me and everybody else the same pill for the same syndrome or whatever outcome they're looking for. And here at Magnolia Health, we and other natural health practitioners, we're looking to look at your lifestyle changes and what you need to do because of the way that your body is predisposed to handling everything around it. So that would be what is going to happen here. Now, if you're looking at something like biohacking, which would be for athletes or people in the fitness industry or people that want to improve their health at a higher level, longevity, we're going to be looking at what it takes, even if you're healthy, to come up with solutions to continue that life on and improve it even further. There are basically minerals and elements and things that, and lifestyle changes that you can make that it can extend your life. It's been proven to extend your life, and it's been proven to give you a healthier lifestyle. And so that would be the biohacking component of people that want to come and say, here's where I'm at, here's what I've been doing, it's working, it's not working. What suggestions do we have from a natural perspective to inspire ourselves to a higher level? And then the third would be hormones, both for male and female. Male hormones are pretty specific, or pretty simple. There isn't a whole lot to them, but female hormones are another really rabbit trail that women can go down. There's a lot of false information. There's a lot of people that you can listen to on various social media. You can read a myriad of opinions, but specific to you, there are things that can be done through your lifestyle and through supplements and through just changing your food and your sleep habits, and a lot of it has to do with your hormones or with your stress levels that we can do to hopefully balance things out at any age, but that's one of our focuses here. So what would we do to extend beyond those three things is we have the ability to go to third-party testing, which is then we would sign you up for the ability to do a saliva or blood test. There's everything from testing the vitamin D to a full-blown Dutch test, which I highly recommend for women. But there are expenses to those things for those testing agencies. But then that information is shared with us and with you, and we can then continue to make a more specific and detailed assessment of what it is you need to, again, elevate your health and hopefully make it so that you can do it even on your own. We also have the ability then to prescribe things, and I don't really like to use the word prescribe because we don't prescribe, we're not doctors, but we can, through our dispensary, we can add kind of a stack, if you want to call it, of 3 or 4 or 5 things, and then you're welcome to buy from our online dispensary if you want suggestions for that. As well as when you come in here, we do have a full store. It's not open to the public. It's not an open public retail store, but you can buy things here as one of the clients and utilize those to try to improve your health. That is not our focus, but obviously through lifestyle changes, then supplements can be a real advantage to helping you elevate some of those areas where your body is weak. So that's what would happen here through an assessment. Now, magnoliahealth.store is where you sign up for that. If it's a Zoom call, it's basically exactly the same. It's just not as personal, but we can do Zoom calls really all over, wherever and all over. Since we are not licensed as medical professionals, I can give you an assessment if you're overseas for that matter. So feel free to sign up for that. We are doing a special for the first 3 months of this year. We're only doing them at $50 for both sessions. And then if we want to do an ongoing, which you would then meet with me every 2 weeks or every month, or we'd have a Zoom call every 2 weeks, we can do that, and we would then come up with a price for that. But normally services from somebody who's board certified, you're looking at some substantial costs for you to meet. It's not covered by insurance to keep our costs down here, but you also then would pay for all the additional services that people want to provide. So what you're going to get here for the $50 for the first 3 months of the year is an hour to an hour and a half assessment, everything that we can come up with, some of which we may have to then do a follow-up, and especially if we then send out test reports and whatnot. But it cannot hurt you in this first 3 months to do something, to come on in and have an assessment and see if we can be a benefit to helping you support your body systems. Again, we're not going to do quick fixes. Most things are not. But if there are things that you can change that can help you, then that's what we're here to do. So we look forward to you guys coming in. Feel free again to magnoliahealth.store. You can also send an email, info@magnoliahealth.store. You can contact us there, and hopefully we can be of help to you in the coming months. After that 3-month period, then we're going to go back to our regular fees and assessment costs. So we look forward to seeing you very soon. Thank you.